My name's Andrew Gilman and I farm here in Tamworth in Staffordshire. We milk a herd of 300 predominantly Holstein cows. We milk them 3 times a day, all year round calving. Prior to 2 years ago, I really had no awareness of Q fever. It wasn't something that I knew about, hadn't really read much about it at all. And it was only once Q fever had been identified in my herd that I then learned more about it. Fertility has always been our biggest issue on the farm. And as any dairy farmer will know, if your fertility is poor, it affects everything. It affects your bottom line, milk production, everything. My vet Carolyn suggested we do some blood tests for it, which we picked a random selection of cows. We blood tested them, and some came back positive with Q fever.
My name is Carolyn Bagley. I work for Scarsdale Vets and I'm one of the routine vets here at Statfold Farm. For many years this herd has had really poor fertility, and we have brainstormed everything we can think of to do with fertility and worked on a number of areas, and it's felt like there's been something underlying pulling down the fertility that we couldn't get on top of and we couldn't get a handle on. So conception rates were pretty poor, and also we were seeing quite a lot of mid-term losses. So there were a large number of cows that would come to drying off and then be empty at drying off. We weren't quite sure when they'd lost the calf, but it was some point between the PD and the drying off. So poor conception rates and mid-term losses were the main things that we saw.
We started vaccinating the herd for Q fever 2 years ago in the January. It is still early days, but for the past 6 months, we've really seen a significant improvement in fertility. Just noticed it to start with, whereas on a fortnightly vet visit with doing pregnancy diagnosis, normally I'd be over the moon with a 50% PD positive out of the cows that were presented to the vet. But then when we were starting to hit like 90–95% PD positive, that was the first changes that we saw. First of all, we thought, is it a blip? But it has continued on for the past 6 months. I was faced with a situation where Q fever had been identified as present and a factor on my farm, and it was explained to me that Q fever is the disease that affects fertility. We have poor fertility on the farm. There is a vaccine available for Q fever, so it was a pretty straightforward decision on my behalf to go forward and vaccinate the herd.